Linda Ujafisa. I messed up your last name.
That's okay. Good evening. Thank you for letting me speak. My name is Linda Ujifuza. I am the co-chair of the Rhode Island Healthcare Access and Affordability Partnership. That is an affiliate of the Physicians for a National Health Program. I believe that I will say the awful words that y'all don't want to hear, and that is we should all be considering single-payer Medicare for all. Now, I understand that that is an existential threat to the folks around this table, and it is a threat because we are suggesting that private insurance companies leave the position of being the multiple middlemen who are sucking about 1/3 of every healthcare dollar away from actual delivery of healthcare. And I'm a little concerned that our primary speaker, though with tremendous credentials, belongs to an organization that appears to be primarily populated with payers. And I'm a little concerned that there's nobody at this table that represents the larger picture of trying to eliminate the costs that come from the expensive private MCOs. And I would suggest that you all look at Senate Bill 584 that was presented last year, and I believe it was in front of Senator Miller's commission, and that was to look at doing an audit of how the MCOs are performing as being involved in running the Medicaid program. Prior to 1994, the state ran it. Connecticut did a similar audit and booted the private companies because they were finding that they were being charged tens of millions, I believe hundreds of millions of dollars too much, and they are quite successful because they eliminated the private MCOs. So that's a question that, because of the people around the table, I feel will not be addressed, and I understand that you all have to protect your own interests. But Senator Miller, I would request that perhaps the purpose of this committee be expanded so that real answers that are provided by single-payer Medicare for all, be considered. Thank you.
So I just want to discuss that briefly in that there are some legislators and there are some people that are involved in looking at this issue who can walk and chew gum at the same time. And what I mean by that, and I don't mean that in any way derogatory, but I mean that in that we can consider other payment methods that are very, very ambitious, like single payer, at the same time that we can think about improving the system that we're working in now.
Understood.
And so the system we are working in now is a system with a lot of payers and with a lot of structures, MCOs, ACOs, Medicaid, self-insured. And to look toward the ambition of improving is something that I'm very interested in, and going beyond the system that we have now. But that's not going to preclude me from trying to improve the system that we have currently.
We understand that.
And so the system that we have currently has a serious impact that we may be able to improve upon before we get to where we might want to be in a different structure of payment. And so I can look short term and I can look long term, and I hope that, well, I use the I, meaning legislators in general or policy people in general, and that I think it would be irresponsible for us to focus on one and not the other, that we can do both.
I would be thrilled if we could do both.
Yeah.
Thank you so much, Senator.
Yeah.